part of this is also really the ability to celebrate the dawning of a new program in a sense of really bringing it through to completion, which has been an exciting journey for us for the past several years, and is one that we've really seen from concept to reality and in a very seamless transition, but also in a very rapid one, and during some interesting times nonetheless. So we're happy to be able to celebrate with you all today. To start, I just want to recognize first our School of Pharmacy and Health Sciences leadership. I led in this particular program at the Master of Public Health level by our program director, Dr. Bojana Berek-Stojcic. She is our program director and an associate professor of public health here, and really has spearheaded this effort from concept to reality. It's been a delight to work with her at building this program. Also, our executive associate dean, who's unable to be here today, Dr. Anastasia Rivkin. Our associate dean for strategic initiatives, Dr. Barbara Rossi, and our associate dean for student affairs and administrative operations, Dr. Chadwin Sandifer, also playing the role of one of our graduates and receiving his Master of Public Health today. So we are delighted to be able to have him join us here, both as a graduate and also as an administrator to our program. Equally, I would be remiss if I did not acknowledge the very hard work, the tireless efforts, and the really kind of adventurous spirit of our faculty from the Master of Public Health program. As I just mentioned a moment ago, Dr. Bojana Berek-Stojcic is the program director. Additionally, Denise Rizzolo is our assistant professor of public health and also is our clinical coordinator for the program. And so we have a number of other faculty who have really been excellent in their roles as subject matter experts and who have really assisted in building the program also with this very pioneering spirit. And those folks include Ulrike Berzau, Richard Conti, Holly Funkhauser-Kukazella, Jolanta Krujelinska, Sanjoy Roy, Manan Shah, and Jessica Silla Estriplet. And we, again, are grateful to those individuals who have really taken on this challenge of building a program, not just from the ground up, but doing it amidst the pandemic and doing it in a fully online fashion, which is something that's unique for us. It's our first program that we've been able to deliver in a fully online fashion, also in an accelerated fashion. And it's one that we really are excited to have seen to culmination today. And we are so delighted to have each of you be a part of the program and be amongst its inaugural alumni. And so we're thrilled to celebrate with you today. So on behalf of all of us within the School of Pharmacy and Health Sciences, we want to just first off recognize you as our inaugural class and really just let you know truly how excited we are to commemorate this day. And even, again, more excited to recognize those of you who went on a pioneering journey with us through an intensive 18-month program that each of you truly has navigated with great grace and great ambition. It's interesting that as I speak to people often about the exciting new parts of our school and many new programs that were underway and ready to launch, we talk about often the things that are in development, and somehow I seem to sound very wise and very prophetic as I talk about the launch of a public health program during a once-in-a-generation pandemic. Truth be told, as we began planning for this program, we honestly had no idea what would be about to come forth, and we had no idea the way in which our world and our society would be turned upside down. And for that matter, I suspect that for each of you that enrolled in this program, you had no idea when signing up that things would take the shape the way they have, and the way in which public health decision-making, both good and bad, would become front and center to our daily lives, quite frankly, in a way like had never been done before. Over the past near 15 months, public health has become a true living laboratory with data and decision-making everywhere and on everyone's mind at all times. Epidemiological curves, values of R0, contact tracing, hospital saturation points, infection fatality ratios, all terms that often were only jargon amidst a very small pool of people who knew what they meant, have now all become part of our society's vernacular. And even more so, we began to see the effects of many years of neglect and lack of attention showcase how truly unprepared we were on the world stage to navigate the challenges of a pandemic, and how, frankly, we are reliant and integral to public health in being a key decision maker for our daily lives. Each of you were provided with the opportunity to learn concepts in the classroom and then apply them directly to the life that you live outside of that classroom amidst a real world case study playing out on the world stage. Sadly, we also saw that layers of tragic consequences unfolded that will bear out over years and, frankly, over a generation. We saw in real world example the consequences of health inequity and health disparities play out, with many lower income and less privileged members of our society bearing the brunt of public health decision making. We saw our nation's children lose access to their lives and everything that they hold familiar, opening doors to consequences of mental and behavioral health issues that we will feel for years and decades to come. We saw our nation's elderly afflicted by a disease, particularly in long-term care settings, where we failed to do what is so fundamental, which is to protect the most vulnerable of our society. On the other side, we saw and were encouraged by healthcare workers who diligently and tirelessly worked to save and protect lives amidst the most challenging of circumstances. We saw the rollout of a vaccine plan in unprecedented record time, and over 5 months, saw a public health intervention go from concept to implementation with nearly 250 million doses administered. We saw teams of healthcare workers coming together with a focus on public health like never before, and we saw much of this happening in real time. There has perhaps been never a more exemplary time to apply public health from textbook to real life, and each of you had this unique opportunity to witness and partake in this hands-on applied learning. What became clearly evident, even if always known behind the scenes, is that public health is arguably the most critical discipline to keeping our individuals and populations safe. It is the key to our ability to provide context to the fundamental concepts of access, equity, prevention, compassionate care, ethical and data-driven decision-making, and overall health and wellness. Without applied concepts of public health, we see egregious gaps in our society. Without these concepts, we see a healthcare system unprepared and unequipped to manage emergent needs. Every concept, every discipline, every decision can be managed through the lens of public health. When we view the world this way, our decision-making often looks a lot different. As each of you departs from this program with your degree, you embark upon a world ravaged by COVID and challenged by the devastation laid in its path. While the death toll is tragic in its own right, it is sadly only a fraction of the devastation that will impact us for years to come. A mental health toll has already been taken on an emotionally fragile society, the likes of which we have never known before. Our nation's children have lost access to education for over a year, and for many lower income children, there's also been a loss of access to many of the community support services that a school provides. An alarming statistic reveals that almost 20% of children in several major cities are reported to have never signed into online school, meaning that nearly 1 in every 5 children has been lost to this pandemic. A great number of people in need of medical care have foregone that care, leading to misdiagnoses and poor prognoses for diseases that require early intervention, like cancer, heart disease, diabetes, and COPD. The gap in wealth has increased like never before, with the wealthiest 1% of our society amassing billions in new wealth, while the unemployment and financial impact has been shouldered by lower income workers disproportionately. Your role as you enter the field of public health is to find a way, one step at a time, to begin to build back what has been lost, brick by brick and piece by piece. This task will not be easy, and it will not be accomplished without a concerted, deliberate effort by all of us moving the needle in whatever way we can. It is critically important for each of you that you take all that you've learned and look at ways to impact public health before we fully lose a generation to this pandemic well beyond the already tragic toll of the illness itself. And in so doing, your impact will be great on the individuals and populations you serve, but perhaps even greater on the profession and the impact on how public health is practiced and represented in this country. The Great Depression and World War II brought us the greatest generation, which was a generation of individuals who had to overcome enormous amounts of strife to accomplish things that very much set the table for us to all be here today. Each of you has an opportunity to use these challenges and be your own greatest generation, using them as a stepping stone to greatness. For all of you, your time is now. And as we turn the corner on the winter of this pandemic, we see the spring emerging and beginning to unfold. And so my call to you is never forget the foundation that's been set through the things that you've learned here, and may it always be a guidepost that sets the way for your future. Again, on behalf of all of us, congratulations on your accomplishment on this milestone day, and we wish you all the best in your future. Now, I'll turn the floor over to Dr. Bojana Berek-Stojcik, our program director, for comments on behalf of the program.
Thank you, Dean Avaltroni, for these really inspiring and encouraging and supportive words. And thank you for all the support you provided us in this endeavor, and actually beautiful and nicely challenging path to our first graduation celebration. I would like to welcome everyone, Associate Provost Kelly, to you, Dean Avaltroni, Associate Dean Sandifer, faculty members, and dear guests, of course, our MPH candidate. And I have a message from Provost Small. She is unable to join us today. She extended her best wishes and congratulations to all of you. With great pleasure, I address our very first MPH class of 2021 graduating today. Needless to say, we applaud your success and appreciate very much your willingness and courage to take the first steps with us on this exciting journey into the Master of Public Health degree in our developing program. I am very proud of each one of you for your commitment to the program, for your seriousness and diligence in completing the degree. It was not an easy task, especially if you had to coordinate family life, full-time job, and full-time studies. In addition, the past 14 months were extraordinarily challenging for all people, demanding undeniably necessary lifestyle changes due to COVID pandemic. Hats off to all of you. You mastered all of the tasks with grace and success. Just like any adversity in life, it has its negative side, but it also has the side that allows us to learn and to grow from the experience. COVID-19 pandemic taught us lessons both at the professional and personal levels. We fine-tuned our understanding of viral infections, transmission, prevention, treatment, health communication, policies, the role of politics and media in our work and lives. We reassessed our own values in terms of meaning of life and family, relationships, who and what is important in our lives, and we reorganized and reprioritized our wants and needs. We all learned a lot. I am especially proud of our ability to maintain the steady course in program development, and I thank you for your commitment and hard work that sustained us in this effort. Our faculty members who contributed to our program and to your professional growth with their expertise and unselfish commitment deserve a special recognition and appreciation. As always, in times of my academic achievements, I remember with gratitude my parents and my family, and I would like to express my gratitude to your families for supporting you along the way. Thank you, and I hope that they are very proud of your achievements and success. And now I would like to present to you the class of 2021. Maria Elizabeth Concepcion. Claudia Curie. Michael D Arcangel. Julie Kalabalik Hoganson. Chadwin Sandifer. Amani Sato. Congratulations to our inaugural class of 2021. Yes, I don't know if we can all be unmuted and join in celebrating and congratulating our students, our graduates actually. At this time, I would like to invite Professor Denise Rizzolo to present our Public Health Service Award.
So thank you. I'd like to both introduce our recipient for our Public Health Award and also our speaker for today, and that is Michael D Arcangel. So I just want to tell you a little bit about Michael. He's from Whippany, New Jersey, and during his practicum, he did his practicum in Whippany, New Jersey. He's actually from East Hanover. And during his practicum at the health department in Whippany, he was a contact tracer. He discussed vaccine distribution and reviewed trends in Morris County. He also assisted the local health clinic in scheduling vaccine appointments, and he helped eligible residents determine how to overcome barriers to receiving the vaccine. Now that he has graduated, he plans on getting his health officer license, and he would like to work for a local health department. So Michael, if you can come on, you can do your speech. You just have to unmute yourself.
Thank you, Dr. Rizzolo, thank you, Dr. Rizzolo, for the great honor for that award. Really appreciate it. So here we go. So good afternoon. My name is Michael D Arcangel, MPH candidate, a member of the first graduating class of the Fairleigh Dickinson University School of Pharmacy and Health Sciences, Masters of Public Health program, and I would like to welcome all of you to the graduation ceremony today. Before I begin, I'd like to take this opportunity to thank Dr. Bojana Barish-Stozic for giving me the honor of speaking before you today. As we draw closer to the end of our studies, the real journey of our lives will soon begin. As I pondered with what I wanted to share with you today, I think it is important that everyone understood the meaning of public health. According to the Centers for Disease Control and Prevention, public health is the science of protecting and improving the health of people and their communities. This work is achieved by promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. As we started our studies in public health, little did we know the nightmare that awaited us and if we would be ready to respond to it. In the year 2020, the world experienced a rare pandemic that caused hundreds of thousands of deaths in the United States alone and caused millions of deaths throughout the world. COVID-19 not only caused catastrophic proportions of illness and fatalities, but it also changed the direction of how we lived our lives. Scientists and public health professionals scrambled to not only understand the virus that had contaminated us on a global level, but to find out what steps were necessary to be taken to contain it and help those who fell ill to this silent, deadly killer. It was the first responders, doctors, nurses, EMTs, and healthcare workers who pulled together and to serve and protect the families we love and care for so very much. These healthcare workers had to work extremely hard in uncharted area and in record-breaking time to curb and neutralize the spread throughout communities, cities, states, and countries. Our role as future public health practitioners has evolved tremendously since this pandemic began just a little over a year ago. We are required to test on a monumental scale. We are required to quarantine and isolate individuals who have been infected with the virus. We are also required to contact trace, and we are required to update individuals with the latest guidance from credible sources such as the CDC and the National Institutes of Health. These are some of the new roles and responsibilities that public health professionals must perform on a daily basis in order to keep everyone safe. In January 2021, I had the pleasure of interning at the Hanover Health Department in Whippany, New Jersey. In my position, I gained firsthand knowledge and skills on how to contact trace and acquired extensive insight on quarantine protocols that should be followed in schools, daycare centers, and at universities. I also worked on a project that determined how many residents were eligible to be vaccinated before March 19th of 2021. I pinpointed a list of barriers that can prevent individuals from getting the COVID-19 vaccine and narrowed down a list of solutions that can help these individuals navigate through these barriers. As a result, this project has significantly helped the Hanover Health Department realize what needs to be done in order to increase vaccinations throughout the community and to adjust their COVID-19 response. As a result of the past year's experiences, the direction public health has taken will never be the same again. It now encompasses various components of research, testing, therapeutics, intervention, and technological advancements like never before. These measures have taken us from a dark and fearful place and catapulted us to a place of hope and new beginnings. So to you, my fellow classmates, I believe the journey that we have chosen together will significantly change the course of how things have been done in the past. In the foreseeable future, we have the power, knowledge, drive, ambition, courage, and skills to put an end to this unforeseen tragedy and to make the world a better place. I wish each and every one of you the best of luck in your future endeavors. Congratulations on a job well done, the Masters of Public Health class of 2021. Thank you so much.
Thank you, Michael, and congratulations on your award.
Thank you. Thank you so much.
And this was really nice and then encouraging and inspiring address that you gave to your colleagues. I'm so very proud of everyone. I would like to ask actually everyone, this was not in the script, but I would like to ask everyone to unmute and maybe we can join in applauding or in some humane way to express our feelings and celebration and happiness about this special event. So,
Congratulations, everyone.
Congrats.
I'm so proud.
Congratulations, Michael.
Thank you so much.
And thank you everyone for being here. As we close now, I really would like to congratulate again very, very sincerely to everyone and to wish you all the best in your future path. And don't forget us. Return, this is your home. Yes, it was virtual and it is still virtual, but still remember to come back. We will be here. Congratulations. And thank you all.
Thank you.
Yay, Claudia.
Congrats, Claudia.
Go, Claudia.
We can
And
throw
all
our
your fellow
heads.
classmates. Congratulations.
Congrats, Claudia.
Thank you, guys.
You're welcome, darling.
That hurt? Yes.
Say congrats. Say congrats, auntie. Say congrats.